Somewhere on a country road in rural West Virginia, a car makes its way to the nearest Frontline medical facility. Any hospital or urgent care facility in the United States capable of delivering emergency care is defined as a frontline healthcare facility. There is a passenger in the car who's presenting a number of troubling symptoms and recent travel experiences to suggest she may be carrying an emerging infectious disease. An emerging infectious disease is one that has newly appeared in a population or have existed and are rapidly increasing in incidence or geographic range, or are caused by a Category A, B, or C pathogen. The woman in this car is presenting symptoms from Category A. These pathogens pose the highest risk to national security and public health. Because they can be easily transmitted from person to person, they cause high mortality rates. They have potential for major public health impact, including panic and social disruption, and they require special action for public health preparedness. Category A pathogens include anthrax, botulism, plague, smallpox, tularemia, and any of the viral hemorrhagic fevers, including dengue and Ebola. The patient of interest has now arrived at her local hospital. What happens next not only impacts her health, but also that of the medical staff, other patients and visitors to the hospital, and ultimately, the community at large.
Hi, can I help you?
Yes, I really haven't been feeling well lately. I'm just feverish and I'm really starting to worry.
When faced with the possibility of a patient presenting symptoms of an infectious disease, the Frontline facility has a twofold mission. One is to rapidly identify and triage patients with relevant symptoms. And two, immediately isolate any patient with relevant exposure history and symptoms, while taking the proper precautions to protect staff and others.
Have you been outside the United States at all in the past 21 days?
Yes, I have.
Okay, have you had any contact with any patients with Ebola or any infectious diseases in the last 21 days?
I don't think so, but I guess I don't know for sure.
Okay.
By admitting to symptoms and recent overseas travel within the last 21 days, the patient triggers the process whereby an emerging infectious disease may be successfully identified and contained. At this point, there are 3 steps the receiving healthcare professional should take. Maintain a 3-foot distance from the patient. Attempt to keep the patient away from other staff, patients, and visitors. And contact a triage nurse who will assume responsibility for the process at this point. The triage nurse will gather a relevant exposure history from the patient in order to determine if she is a person of interest, presenting symptoms consistent with an infectious disease.
Can you tell me what countries you have visited outside the United States and when you returned?
Yeah, I was in Liberia, and then I had a connecting flight to London, and I got back 2 days ago.
What were you doing in Liberia?
Oh, I'm part of a missionary group that went over there.
Okay. Have you had any contact with an Ebola patient or anyone with infectious diseases?
No, but I did attend a funeral in one of the villages.
Do you have any stomach aches, nausea, vomiting, diarrhea?
Yes.
Okay. Do you have any muscle aches or fatigue?
Yeah, I do.
Any unexplained bleeding?
No.
All right. Did anyone bring you to the hospital today?
Yeah, my friend Jeff.
All right. So we're going to need, just as standard protocol, to get you into an isolation room. It's just as a precaution while we determine our plan of treatment. We're going to need your friend to wait in an isolation room as well.
Further questions will be asked, but at this point, enough relevant criteria have been met to establish this patient as a person of interest. In this instance, presenting symptoms and experiences consistent with potential exposure to an infectious disease like Ebola. Having been identified as a person of interest, the patient will immediately be directed to don appropriate personal protective equipment, or PPE, in an unoccupied area to limit exposure to others. Any person who accompanied the person of interest must be isolated. Implement the standard contact and droplet precaution. Notify the hospital infection control and health department. After they have departed, the room must be sterilized to limit contagion.
All right, I'm gonna need you to put your gloves on. This is your gown, your booties, and your face mask. Just put the gown right over your clothes and put the booties over your shoes. I'm gonna need your friend to do the same thing. I'm gonna go get a room ready for you, and I'll be back shortly, okay?
The patient will then be immediately taken to an unoccupied area to don their PPE. The triage nurse must contact local public health officials to inform them of the patient and to get guidance on how to proceed. A subsequent call will be made once a more extensive history has been taken, after the patient has been properly isolated and the triage nurse has donned appropriate PPE. If Ebola is suspect, the health department will contact the West Virginia Division of Infectious Disease and Epidemiology. To suspect a patient as a person under investigation for Ebola viral disease, the triage nurse must confirm Ebola viral disease symptoms, and the patient must have demonstrated a risk of exposure via recent travel and/or with known or highly suspect contact with an infectious person. If indications are positive, then proceed with notifications for a person under investigation for Ebola viral disease. Every effort should be made to isolate the patient in a room away from others, preferably with 2 exits and a private lavatory. If a private lavatory is unavailable, then a portable commode must be placed in the room. Recommended isolation procedures include signage and an entry log on the door to control and track access to the patient's room, limited use of sharps, phlebotomy, and lab testing, avoidance of invasive or aerosol-generating procedures. Team up with a buddy to assist in properly donning PPE. Remove any jewelry or other personal items, including items in pockets and hospital identification. Assemble and inspect your PPE, including 1 pair nitrile gloves appropriately sized, a full hood, impervious jumpsuit, 1 pair of boot covers, N95 respirator, face shield, 1 pair long cuffed gloves, tape, and hand sanitizer. Wash hands with hand sanitizing gel. Then have a buddy record temperature. The buddy should perform a visual inspection for any obvious breaks in the skin, as well as to make certain jewelry or other objects have been removed. Use hand sanitizer to sanitize hands, then don the inner nitrile gloves. Don the hood and impervious jumpsuit. Take care to lay the hood over top of the jumpsuit. If the suit does not include foot protection, don the boot covers. They can also be used as an added layer of protection over the foot section of the full-body impermeable suit, commonly referred to as a jumpsuit. When preparing tape to seal boot covers and gloves, it is important to create a tab on the end of the tape. This will make the PPE less likely to tear during the doffing process. Tape the boot coverings over the jumpsuit. Tape should be applied loosely so that the adhesive forms a seal over the garment edge. Don the N95 respirator, taking care that it is worn with the straps separated around the ears and with the face mask pulled under the chin and pinched to fit the nose. The user should gently exhale with their hands over the mask section to check the seal for a good fit. Don the second pair of gloves. It is important that the gloves reach above the sleeves of the jumpsuit. As with the boot covers, make certain the tape is tabbed prior to use. Then use it to close up the boundary of the second pair of gloves and the jumpsuit sleeves. Don the face shield, making certain that the attached veil is fully deployed. The buddy will carefully inspect zippers and for any rips or tears or open areas, particularly around the taped joints. The user should test their range of motion to determine if there may be any potential problems with ripping or tearing when moving in the course of providing patient care. If desired, an apron can also be added over top of the suit. Prior to leaving the room, the user should sanitize their gloves again. Once the patient has been isolated and the triage nurse has properly donned their PPE, the triage nurse will record vital signs and gather additional information. including a more detailed exposure and travel history. Then she will again contact public health officials to relay additional information, as well as allowing the officials to interview the patient. For this training scenario, the patient had traveled to Liberia, stayed and ate with a local family, saw unknown sickness in the village with 2 deaths, helped with preparations and attended a funeral, returned home 2 days ago, started her own symptoms yesterday, had limited activities and contact only with immediate family since being home. The health department advises that the patient be considered a person under investigation for Ebola viral disease, tested for that and other diseases, and prepared for transport to either Charleston Area Medical Center General Hospital, West Virginia's designated assessment hospital, or Ruby Memorial Hospital, West Virginia's designated treatment hospital. In other circumstances, the course of action might be to transfer the person under investigation immediately to an assessment or treatment facility and to test them there. Likewise, if the patient did not show both symptoms and epidemiological risk factors, the health department would likely recommend that she be discharged and continue to be monitored. Even though the room will be cleaned and sterilized following the patient's isolation, it is important to clean areas and objects that come into contact with the patient as soon as possible. Triple gloving is recommended during cleaning, specimen collection, and patient procedures. Hand sanitizer is used before putting on the 3rd pair of gloves, after all actions involving hand contact, and after removing the 3rd pair of gloves. Note that the first glove should be removed by pinching the outside cuff, rolling it down over all the fingers and thumb to form a beak, then using that to grab the outside of the other glove's cuff and rolling it off inside out. The ungloved index finger then pushes the beaked glove off from the inside. This technique is known as the beak method and allows for glove removal without touching the outside surfaces that might be contaminated. It is vital to determine as soon as possible whether or not the patient is presenting an infectious disease. Once a patient is considered a person under investigation for Ebola viral disease, the recommended course of action is assess for electrolyte abnormalities and replete, evaluate for evidence of bleeding and assess hematologic and coagulation parameters, manage symptoms of fever, nausea, diarrhea, and abdominal pain, collect and test specimens to rule out influenza strains, respiratory and bacterial infections, and malaria. Safely collecting and preparing specimens is critical. Recommended procedures for specimen handling include assemble lab supplies in the room to perform the phlebotomy based on the physician's order, sanitize the 2nd pair of gloves with sanitizing hand gel, don the 3rd pair of gloves, draw the patient's blood per hospital policy, wipe the outside of the vial with disinfecting wipe, air dry, and label. Sanitize the 3rd pair of gloves with sanitizing hand gel. Place the tube swab and specimens into separate biohazard bags. Clean the outside of the biohazard bag with disinfecting wipe. Place the biohazard bag into a rigid portable container. Clean the outside of the container with disinfecting wipe. Next, sanitize the 3rd pair of gloves with sanitizing hand gel. Remove the 3rd pair of gloves and sanitize the 2nd pair of gloves. Transfer the specimen container to a laboratory container outside of the patient's room. Another worker will then carry or ship that container to the lab. To summarize, the steps for specimen handling include obtain patient's specimens, wipe the vial, air dry, and label, place each specimen into a separate biohazard bag, clean the biohazard bag and place into a rigid portable container, clean the rigid container. Another worker will then carry or ship that container to the lab. Hospital preparations for patient transport are built upon established practices with an emphasis on maintaining the appropriate infection control posture while managing the patient, managing volume depletion and nausea vomiting as much as possible. Have the patient apply barrier garments such as a footed impermeable suit, N95 respirator, and gloves to limit exposure to the transport team and their vehicle. Write a patient care report, including symptoms and signs, and the care rendered. Provide this report to the transporting ambulance agency in a manner that assures it is free of contamination. Follow your facility's standard protocols for mission completion, which may include disinfecting exposed surfaces, among others. Patient transport arrangements will be coordinated by the state's health command. Each time someone exits the patient's room, they must remove or doff their PPE. This activity must be performed in an area separated from other personnel and hospital activities. There is a systematic way to remove PPE to prevent contamination of skin and respiratory passages. A buddy is helpful in this process. Disinfectant solution is used to provide an antiseptic area on the mats used for the doffing process. Key steps in the PPE doffing process include: the buddy will inspect PPE for cuts, tears, or any damage or any visible contamination. Then, disinfectant wipes are used to remove any gross contamination. Disinfect the outer gloves. Remove the face shield by tilting the head forward and grabbing the rear strap. Avoid touching the front of the shield. Dispose the face shield in the bio-waste container. Perform hand hygiene with sanitizing gel. Facilities which choose to tape gloves and boot covers must ensure that the tape does not tear the gloves or the impermeable jumpsuit during doffing, and that sharp instruments such as scissors should never be used to remove tape or any other part of PPE. Remove the tape by using the tab, and remove the boot covers by rolling downwards. Dispose them in the bio-waste container. Perform hand hygiene with sanitizing gel. Remove the outer gloves, again by using the tab, and dispose into the bio-waste container. Perform hand hygiene with sanitizing gel. Remove the jumpsuit by rolling it away from the body, and dispose in the bio-waste container. Perform hand hygiene with sanitizing gel. Remove the inner gloves using the beak method, and dispose into the bio-waste container. Perform hand hygiene with sanitizing gel. Don a new pair of inner gloves. Remove the N95 respirator, disposing in the bio-waste container. Perform hand hygiene with sanitizing gel. Remove the hood by lifting the lower edge up and away from the face. Perform hand hygiene with sanitizing gel. Remove the final pair of inner gloves. Perform hand hygiene with sanitizing gel. Do a final inspection to make sure all PPE is removed and disposed. Wipe the bottom of the shoes with disinfectant wipes, and proceed to the shower. It is important to use wipes to disinfect the door frame, knobs, and any other area outside of the patient room that might have been touched by staff in PPE. Because in this situation a buddy is helping to remove PPE, a third trained observer not in direct contact would provide step-by-step instruction for removing PPE and would provide immediate corrective instruction if the healthcare worker is not following the recommended steps. However, the trained observer should not provide physical assistance during doffing, which would require direct contact with potentially contaminated PPE. Waste which is contaminated or suspected to be contaminated with Ebola virus is a hazardous material under DOT regulations. It is likely that there will be bio-waste generated from patient activities and the wearing of protective equipment. Key steps include handling Ebola viral disease-related disposal waste per the facility's waste management plan, and autoclaving equipment and supplies if possible. Disposal waste should be contained in designated bio-waste bags, then bound by tightly closing, folding, and taping. Bags should be wiped with disinfectant wipes. Double-bagged, and then taped shut before transport to the facility's waste collection area. Frontline healthcare facilities are vital to the process of effectively containing possible outbreaks of emerging infectious diseases like Ebola. The decisions and procedures adopted by these facilities critically affect not only the safety of their own communities, but also those of the transport personnel and the staff of a healthcare facility. What's more, properly adhering to these procedures can lessen the likelihood of treatment facilities unnecessarily committing personnel and resources for receiving a patient with a Class A pathogen when testing could rule out diagnosis of an emerging infectious disease before transport.